That's why I love these, virtual meetings. You never can tell who's going to show up. The next bill is House Bill 5067 by myself, and it is, I like the titles, an act relating to human services, promoting access to increased mental health for all students. We all know that our students, and it's a major statewide issue when our high schools have signs out in front of them saying, "You are not alone," aimed at their students and the mental health issues that this pandemic has taken upon all of us. This bill simply states that school psychologists will be included as a healthcare related service for federal Medicaid reimbursement. Currently, social workers in our school have been reimbursed by the federal government for Medicaid. They clock their hours, the school department gets reimbursed. This would have no fiscal impact on local educational agencies and systems. It would also have the effect of giving our local school departments the ability to increase these mental health professionals. The Department of Education called me this morning. They support it. It's a need that has become more acute with the pandemic, and I'll entertain any questions. To me, it's common sense, something we should be doing. Any questions from our virtual participants today? Okay,
Yeah, I have a quick question, Mr. Chairman.
Yes.
So I think this is a wonderful idea. I think that all reimbursable services should be reimbursed by Medicaid, and we know that we desperately need more counseling services in the school. So I strongly support this bill. In reading it, I just have a question about what are time studies that are listed in this bill that would be covered. I just wasn't familiar with that.
There are certain federal laws for reimbursing medical services, counseling services, and for example, when our social workers currently see a student, there's certain documentation that's required, and that documentation is submitted by reimbursement. It's just a standardized federal government form of recording what's going on.
Great, thank you.
Thank you, Representative. Are there any further questions?
Mr. Chairman, it's Franklin Vassell.
Yes. Welcome.
Yeah, I don't have a question. I just, I'm really excited about that bill. We need more, not less, especially now during this pandemic. I am also hopeful, as you probably know, several schools in the urban core in my district that I know for sure, where we do not have a full-time social worker, full-time psychologist, full-time mental health person. So I support this bill 110%, but I'm also just hoping that we can do more.
Thank you. Thank you, Representative Franklin Vassell, and I certainly share your concern, especially in our urban schools. And last year, we passed a bill by Representative Kazarian that would have social workers gather data on the amount of services that they deliver. And I know that from my previous experience of 37 years in Pawtucket, we had our social workers do that towards the end of my career, which was almost like 9 years ago, when the school committee stated that they wanted to cut them back. And when the school committee saw the number of students, and I was dealing with the secondary level, that had been referred for substance abuse issues, for mental health issues, for suicide prevention. I mean, these are huge issues that social workers facilitate and help so much and do a great job. So I agree 100%. We need more social workers and mental health professionals, especially in our urbans where environmental stress is so brutal. So thank you for those comments. Any further questions? Thank you. That concludes the hearing on 5067.